Hey, this is Dr. Stopcheck here at Stopcheck Natural Health and Wellness Center, here with another edition of the Monday Minute. Today we're going to talk a little bit about digestion. Why? Because digestion is so important. If you can't digest your food, then you don't get the nutrients, you don't get the minerals, you don't get anything. So what I'd like to do is I'd like to do like a 4 or 5 part series here, just real quick, talking a little bit about digestion. Today we're going to start talking about the first 2 parts. The first part is chewing. You have to chew your food first to get the saliva to mix with it, which has enzymes. And when that happens, it starts to break the food down. You swallow it, it comes down into your stomach. Once it's in your stomach, then it needs to hit a bunch of acid. I mean, the acid has to be really bad. If you think of your pH as neutral being 7, the stomach acid has to be between a 1 and a 2 for it to work right. If it's not low enough, what happens is your food will rot, putrefy, or just ferment. And so if you don't have enough acid, you end up forming another acid which produces a stress or a pressure in your stomach, and it causes everything to come up and open up through the valve up through into your esophagus. That causes your heartburn, your indigestion. If you have enough acid, what will happen is the lower valve will open up to dump it into the small intestine, which we'll talk about next time. But anyways, I have been taking a product for quite some time. I have a couple of products here. The first one is called betaine hydrochloride. Now, betaine hydrochloride, this is a standard process product. Betaine hydrochloride is a product that is basically an acid. And these are all organic and they work great for you. But anyways, this is an acid. There's another product called Multizyme. You could take the 2 of them separately. This is pancreatic enzymes, which we'll get into next time, but this really increases the acid in your stomach. Better yet would be this one called Zypan. Now, most people do not have enough acid in their stomach 99% of the time. And so then you start taking Prilosec or omeprazole or something like that, and now you're not going to absorb your iron, you're going to get anemic, you're not going to absorb your zinc, your calcium, your magnesium. It's going to cause problems with vitamin C absorption. So it just screws everything up, and then the food particles that don't get digested well enough in your stomach, they're too big when they go into the intestines to be able to be useful. So do yourself a favor, if you have any kind of heartburn, seriously, Zypan. 2 of them with each meal, 2 of them as soon as before your meal. It will help you a lot. If it doesn't work, let me know. Take care, God bless, and we'll talk to you soon.